Well, a warm welcome to today's talk. It's Friday the 7th of May. Now let's start off with the quiz. What do these countries have in common? Portugal, Israel, Singapore, Australia, New Zealand, Brunei, Iceland, Gibraltar, Falkland Isles, Faroe Isles, South Georgia and South Sandwich Islands, St Helena, Tristan Tracuna, Ascension Island. Well, the answer is they're all on the UK list of green countries. They're all on the green list. Countries that Brits can travel to without having to quarantine. That is, of course, if they'll have you. So I think it very unlikely that New Zealand and Australia will be accepting any people from the UK anytime soon. But there is an amber list, there is a red list, and of course this is going to be constantly kept up to date, so it is useful. Now let's get on to some serious matters now. Variants in the UK. So this is the latest Public Health England website on variants distribution of cases. And here we see that, as we would expect, the UK Kent variant is the most prevalent. South Africa, Brazil gives you all that information there. But what I want to focus on is the India variant, because this is the one I'm still a little bit concerned about. So there's the B1617. So that was the first one. So if you like, this is the sort of evolutionary line of the B617. So that would reproduce and reproduce. But then at one point, another one diverged off, and that's the point 2. And then at another point, another one diverged off. That's the point 3. So they all came from this common lineage. But then we end up with 3. So we end up with the original one. So that hasn't gone away. That's still there. The one is, well, it's not classified as a 1, but it's still there. And then we end up with these 3. It's what's called a clade. It's an evolutionary process. So the point is, though, they've increased in numbers. So especially this variant here, the B1617.2 is the one that's increasing mostly. And as we see, there's quite a few cases of that and a large increase. Now, this is 520 cases have been diagnosed. Obviously, there's more cases than that. But in the UK, we're actually doing a genomic analysis, looking at the sequence of the RNA bases in the genome of the virus in around about 50, just over 50% actually of the total cases that are being molecularly diagnosed with PCR test. So this is reasonably indicative, even underestimate. So India variant in the UK. So this B1617.2 is now a variant of concern. It's only taken about a month to make it a variant of concern, but they've got there eventually. Sharp rise, 500 cases, about 520 cases now, actually 40 clusters. Well, as we've seen, there's 520 cases, and that's of the 5th of May. 40 clusters around the country. 318 new cases of this variant since the 27th of April, so it's growing rapidly. There is some community transmission. It's now the most prevalent form of the India mutation. Seems to be spreading more than the other 2 India mutations. And at least as transmissible as the Kent variant. Originally this was leaked. It just came onto the website this afternoon. So originally it was leaked. So the data was a few days out of date. I guess this leak stimulated them to update the website, unless it was a routine update. I don't know. Anyway, so we're seeing an increase in that basically, and we don't know what's going to happen with that. Now, I suspect this isn't going to be a massive problem, but really, it's, as I said before, we don't want to find out. It doesn't have the E amino acid change to the K amino acid at the 484th position that the South Africa variant does. And the thing with that is, this is the one which is probably most associated with immune escape. So it's looking like the vaccines are going to be effective against this India variant. And that's why I'm fairly optimistic about it. But it would have just been so much better not to find out, kind of taking risks here that we don't need to take. Now, talking about sequencing, It's good to see that the United States is improving its sequencing now as well. Now, this is Washington State Health Department report as of the 5th of May, just 2 days ago. And they are greatly improving the amount of positive cases they are sequencing. So here we see that the B117, the UK variant, of course, is increasing in prevalence. We also see presence of the South Africa, Brazil, California, New York, and Brazilian variants there. So again, it's looking like the vaccination program in the States is outpacing these new variants. You know, this was really quite close for a period of time. Now, I'm not saying we're there yet, but had the vaccination program just been a few weeks behind, this could have made all the difference, and we could have had major resurgences in the UK and in the States. The vaccine programs really just came in the nick of time. But when we look at the increased sequencing in the States, here we have the data from Washington State, for example. We see that so that's December. That's December 2020, January 21, and this is more obviously the data is not accumulated here yet. But we see that there's huge increase in the numbers of cases being sequenced, and that's the variance there. So we see that the green here, the B117 is the most prevalent, and then we see that one there, the B1429 is second. Now, what's that there? What's the 1429? Is that one of the 142? Yeah, it's one of the California variants. I thought so. Yeah, but the point is they're doing a lot more sequencing, which of course is very good news. Just recent increases in this in the States. So March 2021, 13.1 of all confirmed molecular COVID cases were sequenced. So getting much better. And it's not a matter of national jingoism or anything, but the UK is still 50%, so it's quite a bit behind still. 16,128 specimen sequenced since January 2020. So the overall average of sequencing since January 2020 is 4.3%. In March, you can see that had increased to 13.1%. So a very good increase in sequencing in the States. Now, a lot of you have written to me with great anger, no other way to put it really, about this next item. UK travellers returning from red list countries are flying home via Turkey. Now, it costs £1,750 per person to isolate in a hotel in the UK. But of course, if you don't want to pay that, don't go in the first place. There's a Turkish report, British nationals flying in from Pakistan, India and Bangladesh. BBC report. So people flying in from Bangladesh, India and Pakistan are just bouncing off via Turkey to avoid quarantine. Returning from Pakistan to the UK, many for weddings or funerals. Now, okay, these things are important, but to be quite honest, they're not more important than the lives of people in the UK who are being jeopardised by this. These hotel regulations are there for a reason. So the BBC gives specific names to point out that this is true. So Shahir said he could not afford the cost of quarantine in the UK. Well, don't come back or don't go in the first place, many of you are saying. Travel agent in Bradford, Mr. Khashoggi, has arranged 15 to 20 journeys home via Turkey. And this is legally allowed. This is just really quite outrageous. Mohammed Saad travelled to Pakistan for a funeral with his son, flew back via Turkey. And this is what he said to the BBC, apparently. It's like an extra holiday. Oh, that's nice, isn't it? Then you can fly back to the UK from Istanbul without hotel quarantine. Now, this is why a lot of you are angry. And I only quote individuals here because it's the BBC have quoted it already. It's in the public domain. It shows this is a real problem. Mr. Ali from Leeds went to Pakistan to Islamabad via the UK, for example. The BBC gives us an example. So we actually have a travel agent arranging this. This is just completely beyond the pale. And that's reported in the BBC, and I understand why a lot of you are angry about that. Now, UK vaccinations still going well. Now, if you click on there and look at the graphics, actually, the overall amount of vaccinations is slightly down in April, and we expected that. It's slightly down because of the supply of vaccines. The amount of first vaccines, of course, has gone down, but that's because the amount of there's vaccines being used for the people that are getting their second vaccine, and that has gone up. So that is why that is. And on the topic of vaccination, Chris Whitty, Chief Medical Officer, until we got a situation where we have induced immunity in those who are most vulnerable everywhere in the world, we'll continue to see really significant morbidity and mortality from this virus. So again, one of these pleas that we need global vaccination. And at the moment, it's not happening in enough places. Now, a brief update from the Zoe symptom tracker app with Professor Spector. Now, Neil Ferguson and the Zoe data both seem to be saying like there's not going to be a further wave in the UK this year. Now, I'll accept that, that's good, but we must carry on and not be complacent for the time being. But he did say that because there's a low prevalence, it means there's more uncertainty in the data. So when you're dealing with hundreds of cases, it's easy to get a few percent out, whereas when you're dealing with thousands or tens of thousands of cases, you can be precise to 1 or 2 percentage points. But with the lower numbers, it is hard to be precise, but it does look like it's still going down gradually in the UK. Now, cases of COVID after vaccination are occurring, and it's very important that the COVID symptom tracker app is, the COVID symptom study is following these. There's less symptoms, less severe symptoms, and less classical symptoms. So unusual symptoms are starting to appear, as well as the classic symptoms that we know about. And Professor Spector says we're now entering the endemic phase in the UK. Globally, not the case, but in the UK. He did talk about post-vaccination menstrual changes. More on that, but he has mentioned some reports of heavy periods, mid-cycle periods, postmenopausal periods. Now, more on that later. He's not exactly sure whether it's a real thing or an artifact of the data at the moment. But we will be keeping an eye on that. But it does show how important it is to log clinical features before and after vaccine on the COVID symptom tracker study, because this hasn't been logged anywhere else officially as far as I'm aware. Chances of getting COVID in the next 24 hours, in other words, what is the prevalence? Not the prevalence, what is the incidence? What's the likelihood of new cases? No vaccine, 1 in 47,000. 1 dose, 1 in 98,000. 2 doses, 1 in 70. 2 jabs, 1 in 170,000. So that's your chances in the UK at the moment. But of course, people that have been vaccinated, less severe symptoms, less classical symptoms. Less symptoms, less severe symptoms. So it's still looking promising. Now, moving on to India. India has not yet peaked. There is a way to go, I am afraid. And we know this because we were talking to Dr. Nair about it last week. India's not going to peak for another, well, at least for another week and probably 2. And that means the deaths aren't going to peak till June. And we're still hearing cases of people not being able to get medical care, people still dying through lack of oxygen. Huge amount of self-help going on in India, volunteers helping people all over the country. Great acts of heroism going on in India, which is really quite moving to hear about, but yet still people suffering and dying through lack of medical facilities because there's so many people making demands on services all at the same time. And as we've said before, medical services for poor people in India are difficult at the best of times, to put it mildly. So new cases in India. This is the 400. That's the 300,000. That's the 400,000 line there. That's the 300,000 line there, and we see they're still going up. And they are. They're still going up. It's still increasing. Likewise, deaths now round about the 4,000 a day mark. So in cases up to the 400,000 a day mark, deaths just now approaching the 4,000 a day mark. So it's still going up. Now, there was hope that the cases in India were going down because the cases were being logged and they did seem to go down, then they seemed to go down a bit, then they went up again. But actually, if you look at the best fit line, that line there, the average, that they are still going up consistently. These were artifacts in the data. The ziggy-zag was artifacts in the data. Countrywide test positivity is 20%. Testing is really fairly low in India. It's starting to pick up a little bit, but it's still quite low. But the tests that are being done countrywide, 20% are coming back positive. This indicates a lot of community transmission, a lot. So at least, I think at least 2 and possibly 3 weeks to go in India because of this high positivity rate. And if we compare global comparison with India's positivity rate, the UK fairly low, then South Korea, then the United States, then Japan. Bangladesh, India and Nepal is way higher. Nepal is about 35% of cases coming back positive. In other words, the prevalence at the moment in Nepal is incredibly high. Incredibly high. Nepal is very poor, very limited health service at the best of times. Limited news coming out of Nepal, but we do know that people are severely suffering because of the high prevalence rate and the knock-on effect on morbidity and mortality. But limited news from there, to be quite honest. So 2 weeks ago, about 1,100 new cases per day. Now 6,700 new cases per day. And of course, these are gross underestimates because the testing is very, very limited. But remember, a better guide in Nepal, because of the limited testing, is the amount of tests that are coming back positive, and we're looking at about 37%, roughly, coming back positive. That is astronomically high. Official new cases in Nepal, we see the graph. It's going higher, but we know that's such underreporting, and is going to continue for a little while longer, I'm afraid. So second wave, there is quite a lot of lockdown. Poor people are really suffering in Nepal because they can't get out to work. There's infections in Everest Base Camp. Now, Nepal earns, I just read this morning, about $300 million a day from charging people to go and climb Mount Everest. And there's hundreds of teams are authorised, but there's now breakouts in Everest Base Camp, as of course, because it's in the western Nepal. And it's a bit confusing for the limited medical staff that are at base camp, because it's a bit confusing with HAPE, which is high altitude pulmonary edema. And there's another one, high altitude cerebral edema, HACE. They're the two problems. The lungs fill up with fluid at altitude, and the brain can fill up with fluid at altitude. And of course, that's the American spelling of edema. But compared to the amount of suffering in Nepal, that's not too big a problem, I suppose, really. But a lot of poor people suffering in Nepal at the moment. The poor people suffering most. Germany pressing ahead with their electronic certification. So for people that are at least 14 days after the second dose, or recovered 28 days to 6 months ago with proof of a PCR test, they're introducing smartphone or physical documentation to give them increased freedoms. And that's certainly going to include travel. And so you'll have a smartphone verification that you're 14 days after your second injection, or you've had the infection within 28 days to 6 months. Interesting there in Germany. So they're equating 14 days after the second dose with one case of natural infection. Whereas the data is showing that the immunity generated by 2 doses of the vaccine seems to be quite a lot higher than the natural infection. So not quite sure what science that German decision is based on, but that's what it is. So basically you're going to need a smartphone to travel pretty soon. In Europe, few people that haven't got smartphones could have physical documentation. And of course, where Germany follows the rest of Europe, normally trots along behind. So that's the way that's going in Europe. The Olympics. Little comment needed really, but we will make some. So cases in Japan are relatively low but are increasing. So relatively low but are increasing. That's only 5,000 per day, so relatively low, but the direction's up. But Japan has, for an advanced country, its vaccination program is an absolute farce. Have a guess. What percentage of the population of Japan have received one dose of vaccine so far? Advanced, sophisticated Japan. What percentage of population have received one dose so far? It's pathetic. It's 2%. What are they playing at? Well, partly we know what they were playing at. They insisted on doing their own clinical trials rather than accepting data from the UK and the US, which delayed things greatly. But they're talking about having the Olympics with 2% of the people currently vaccinated. Extended state of emergencies. So this did start on the 25th of April, I think. It's been extended till the end of May in these major Japanese cities. Hospital pressure in Tokyo and Osaka. There are reports of deaths while awaiting hospitalisation. So in areas quite stretched health services in Japan. So the Olympics could well be a super spreader event if it goes ahead. So that is us for today. Oh, apart from good news, I got it's 11 weeks today. I got my second Pfizer vaccine today. So I was just lucky I got that. I would have been more than happy with any vaccine, but I got it a bit early because it was the end of a batch. But of course, whereas friends of mine who'd had the Oxford AstraZeneca vaccine, they had their second dose weeks ago. So I would have been more than happy to have the Oxford AstraZeneca as a second dose. But it's not on the protocol. Studies are being done now on mixing and matching vaccines. So we'll know about that soon. But at the moment, the protocol says same vaccine both times, unless you're in a trial, which I wasn't, because my area wasn't eligible for the trial, unfortunately. So I couldn't go in the trial. But I got the second one today. Now, what time is it now? It's about what time is it now? It's 6:30 now. So I got it at 2. So that's 2, 3, 4, 5. So that's about 4.5 hours, and I feel fine so far. But I will report on that tomorrow. Anyway, it's good to get it done. So 11 weeks gap is actually fine. That's quite acceptable. Anything up to 3 months is absolutely fine. The immunological response is probably better, if anything, because of the longer gap in between the primer dose and the booster dose. But it felt good to get it. So hopefully if you haven't had yours, you'll be getting yours soon as well. Of course, no benefit at all for 2 weeks after the second dose. So it's a matter of time. Okay, thank you for watching.